Lung volume. The most accurate method of measuring lung volume is whole body plethysmography. Like spirometry, it measures the volume of air inhaled and exhaled. However, since the test takes place in a closed box, technicians can determine the volume remaining in the lungs after exhalation, which allows them to calculate total lung capacity, the total space inside your lungs that air can occupy. Whole body plethysmography takes 3 to 5 minutes. You sit in a clear booth and a technician supervises you. Pipes are attached to the booth to measure the pressure inside and are connected to a monitor. You are given a mouthpiece and nose clip and are asked to breathe normally. Then to pant rapidly while the mouthpiece shutter is closed, and then to breathe as deeply as possible, both in and out. Wear loose, comfortable clothing and avoid smoking for 6 hours beforehand. If you use an inhaler, you may have to stop 6 hours before the test. You may be asked to hold your cheeks as you breathe to avoid changes in pressure in the mouth due to blowing the cheeks out. You can open the booth from inside if necessary. Your residual volume is around 2 pints or 1 liter of dead air in your lungs that you cannot exhale. The breathing pattern. This graph shows the pattern of airflow during the test. When you are asked to pant, the mouthpiece shutter is closed. No air flows, but the volume and pressure in your lungs still change. The technicians measure pressure changes in the booth, which allows them to calculate your TLC. Breathing into a mouthpiece. Whole body plethysmography uses a mouthpiece similar to spirometry. The key difference is that you sit inside an airtight booth, which means that volume changes in your lungs can be measured as changes in air pressure within the booth. The test yields several volume figures in addition to TLC. Tidal volume is the amount of air moved during normal breathing. Inspiratory and expiratory reserve volumes are the additional amounts of air moved during forced breathing. The residual volume is the air remaining in the lungs even after maximum expiration. All these measures can be compared to healthy individuals of the same age, ethnicity, sex, and height. This helps diagnose obstructive or restrictive lung disease, or both. Causes of restrictive disease include pulmonary fibrosis and obesity. In obstructive disease, the lungs cannot allow as much air to leave as normal. COPD and asthma are examples. The results show 4 different volume measurements. Each may be of interest, but together they add up to your total lung capacity, or TLC. Thank you for your attention.